Can emotional trauma cause physical pain? I'm Dr. Michael Lee, founder of The One Method, and thank you so much for joining me today because the answer may surprise you. So just keep checking in because you're probably thinking, if you're actually here and watching this, you're probably thinking, how? Or no, that cannot be. But I'm just here just to give you my experience because let's just think about it. Let's just unpack this logically. Can an emotional trauma cause physical pain? When someone is stressed, what happens to their body? Do they become floppy? No, they become tense. Where do they hold their stress? Shoulders. When they hold the shoulders, it's tense. Guess what's going to happen to the neck? Yes, the joints, the vertebrae, the discs will get compressed. Guess what? They then get neck pain. And that's the end of the live now. Because now I've just proved my point. Emotional trauma, if it happens for long enough, and the mechanism of actually the protective mechanism happens for long enough, it's going to cause destructive compression on the body. Because just think about it, if someone's in fight or flight for weeks, months, if not years, right? They're in this position, they're not sleeping, they've got insomnia, and actually they cannot actually relax. They're in this position. Of course things are going to break down because when things get compressed for long enough, that's where things start wearing out. That's why we have something called osteoarthritis or wear and tear. But then now just think about it this way. What if someone is in, we call it adrenal fatigue. We call it adrenal fatigue that actually the adrenal glands are dumping cortisol into the body. The cortisol levels are through the roof. The body has to respond to that, of course. And it's not just the shoulders are tight, but their entire body is now in a protective state. They're all bracing. That's why when we ask them to do exercises, they're like, oh, my body just feels stiff. I just don't feel fluid. And it makes sense because just think about it. It's not about how strong someone is for actually efficient movement. Efficient movement comes down to muscle timing. And if everything is bracing and everything's on, how do you think they're going to move? Like a tin man. And then guess what? If everything's compressing in their entire body, head, neck, shoulders, elbows, wrists, back, spine, pelvis, hips, knees, feet. Everything compresses for a long period of time. Guess what happens? They get pain. And maybe I'm just going to throw in, this could be the diagnosis of fibromyalgia. And the question is fibromyalgia just basically a result of emotional trauma? Question mark. It could be. It may be other things too. But here at The One Method, we just find out why everything is actually breaking down and why it's happening. Because I'll be honest with you, 99% of all of the therapies that happen in the world right now, they treat symptoms and not the cause. You have so many clinicians that are going, oh yeah, just go and do strength, go and do exercise, just go and power through. I'm like, yeah, power through when actually the whole system's bracing anyway. So actually the joints are just going to wear out. So actually you're just creating self-destruction. Oh no, but Michael, but when you do strength, it's going to be more robust. Yeah, it's going to get stronger, but if anything's not in the right timing, it's going to wear out anyway. So what you actually want, you have to still find out why this is happening, and the why starts here. Because what controls the muscles? The nerve sensors. The nerves can have the signal going to the muscle. What sends the signal through the nerves? The brain. The brain's number one priority is survival. Some people have a worse emotional trauma than a physical trauma. Yeah, how many of you can relate to that? How many of you know someone who's had a really bad emotional trauma and actually their whole life just dropped off a cliff? Everything went wrong. Everything in their body just started to break down, one thing after another, because that is a pattern all patients go through. Some points in their life, everything is fine and dandy, and then usually a big trauma happens. Whether physical or emotional, usually it's a big emotional trauma. Things break down one thing after another. And all these clinicians are kind of treating, oh, let me treat this part of your body that's hurting and that part, let me do some strength. I'm like, why? You're just treating the compensations. Why would you treat the compensation? Why wouldn't you just treat the cause? And the answer is because they don't know how to find the cause and unaware of it. And the second thing, they don't know how to treat the cause. But here at The One Method, we just look for the cause straight away, treat the cause. And I'm going to be honest, it's just from my experience from getting myself out of a wheelchair for 2 years, right, in extreme pain after a surgery, that actually I went from 10 out of 10 pain to 0. But I did that through finding the cause. And there was no exercise, no manual therapy, no special voodoo or psychological special hypnotism or anything like that did it. It was just finding out why my brain was creating the protective mechanism. And as soon as we found out, and this is where, yes, all the students that come on to and learn more about the one method, finding the root cause, just in the first day alone, blows their mind. They always say it's the first, I've learned more in one day than my entire career, including degrees, including experience, including all of the short courses that they've done. Because as soon as they find the root cause, they don't need to wait for things to repair. They don't need to wait for things to get stronger, because as soon as we change the neurology, change how the brain responds to something, how long does that take? Immediately. We don't even have to wait. That's why so many people get out of pain for good, not within like months or weeks, but actually in minutes and seconds, because we understand how the brain looks after the body. But the thing is that if you are one of those clinicians and you're thinking, Michael, this is just voodoo, or this is just crazy. Well, at the end of the day, I only can give you my experience, because I can say that I have the credibility because I've done the 7 degrees. Me studying and understanding how all these areas of the body comes together, then practicing it, then getting results, then finding out what works and doesn't work, then I can give it to the student and say, look, this is tried and tested for 20 years. Now I've done it, not only have I got myself out of pain for good, I've also helped a lady get out of locked-in syndrome, so she was meant to be dead or paralyzed, now she's running. Now I've helped people that were on 24-hour oxygen, right, for 1.5 years, and suddenly they never need it again. Why? That's the question. And the thing is, you're probably thinking, Michael, prove it. Okay, fine. Just go and look at all the videos. They speak for themselves. I've got nothing to prove other than I can show you my results. But I would ask you is this. If you're chasing symptoms, you'll be stuck in the cycle. That the symptoms keep coming back over and over and over again. If you're just giving strength, giving like stretchings and that, you'd be stuck in a cycle. It just keeps coming back. And you're thinking, but Michael, don't we need to maintain? I said, yes, you can maintain your patients. But why would you maintain them at such a low standard? Why wouldn't you maintain them when everything is working properly? That's the question. Because wouldn't you want that as a person as well? Wouldn't you want to be operating at your best consistently each and every day, no matter what time of day, whatever place you are, whatever environment you are, and that you're knowing that actually the brain is operating at its best, so it's looking after its body at whatever day of the week it is, knowing that you'll perform at its best. But ultimately, it's what it comes down to. Knowledge is power. Knowledge is power. So this is the thing, if you want to actually find out more about how we actually do this, or you want to look at all of the success stories, because we've got tens of thousands of them anyway, just let me know. Just put me in the chat. One of our advisors will actually come in to speak to you and let you know, right, this is the first step. These are the things that you need to do before we even allow you to come into the course, because I tell you now, you must have really good neuroanatomy. If you do not have good anatomy, that's your roadmap. If you don't know the anatomy of the brain, the ins and outs of what's happening, and yes, I am giving you resistance, because I'll be honest with you, I do not want people who say, oh yeah, I want that, but they never actually take action. I actually want the clinicians that want to be the best in the world. The best that can get the results that I get, and then teach the next generation, then the next generation that actually makes a difference in this world. My mission here isn't for me to be, oh look, it's Dr. Lee, he's the most amazing person. That's not my mission. My mission is to leave a legacy that every one of these clinicians in the world can pass it on to the next, so that every single person in each 4 corners of the world have an opportunity to live a healthy and happier life without the fear of having pain or anything breaking down ever again. But that's my mission. And I really hope that you see the passion in my own voice, in my heart, that I want to give. But this is what I always say to students is this. Don't get me wrong. You can go and study the 7 degrees I did and go and work it out. Or I can just give you the shortcut. And once you have the shortcut, you can then implement it straight away in your practice and get results straight away. If that's something you'd like, put me in the chat and one of our advisors will give you a call and just find out if you're a good fit. And if you're a good fit, then of course, we'd love to welcome you to the family of the elite. I say it's the elite clinicians, the ones that will make a difference in this world, not the ones that are kicking and screaming and complaining that this works, that doesn't work, because those are the people that I always ask them. I say, oh yeah, Michael, that doesn't work. Chinese medicine exists. That doesn't work. That's just voodoo or whatever it is. I'm like, well, firstly, I ask them, have you studied it? Generally, they say no. Well, if you haven't studied it, you haven't even experienced it. You haven't even used the tools. If you ain't used the tools, you ain't got the results. If you ain't got any of those, you have zero credibility. Until you've done that, then we'll have a conversation. But at least I've got the credibility because I've gone through the whole journey. Because I had to do it because I wasn't content at 20 years old for being in a wheelchair for the rest of my life. I went to study and study hard to put everything together to really find out what happens here in the nervous system, in the body, and how to make sure it is so robust that actually everyone can have the success that they want in their lives and in their bodies too. So anyway, thank you so much for watching today, and I look forward to seeing some of you very soon. Have a great week. Bye for now.